So welcome.
Thank you very much, Chairman Conyers, and to the members of the committee for the opportunity to testify today in support of H.R. 5034. I am a public health lawyer and the Research and Policy Director at Marin Institute, a nonprofit whose mission is to protect the public from alcohol-related harm. While the discourse of this bill has pitted different sectors of the alcohol industry against each other, that fight is irrelevant to us. Our only interest is what is in the best interest for the public's health and safety. Indeed, Marin Institute often disagrees with the industry proponents of this bill on other policy matters, and will likely continue to do so. Our goal is to advance prevention policies to reduce the tremendous harm caused by alcohol consumption. Far from being a benign substance, alcohol use causes a wide variety of harm, even when consumed at what the federal government defines as moderate levels. In the United States today, alcohol remains the third leading cause of preventable death. At least 85,000 deaths are attributable to alcohol consumption each year. Also, the economic costs of alcohol were estimated to have been $220 billion in 2005. Much of that cost is from lost productivity, meaning that businesses and our economy also suffer greatly. And while my organization is based in California, Marin Institute has always been a national leader, and we work closely with policymakers and public health advocates at the state and local levels throughout the nation. I can attest to the critical role that state regulation of alcohol plays in giving policymakers and advocates the tools they need to protect the public. Indeed, I just returned speaking from Wisconsin and Massachusetts, where state and local lawmakers, along with public health advocates, were gathered to learn how they can help advance effective prevention policies to reduce alcohol harm in their communities. At both events, it was well understood that states have the authority to regulate alcohol. And yet this authority, which has largely been taken for granted, is increasingly coming under attack by those who want to see federal law trump well-established state authority. The current state-based system of alcohol regulation has been in place for a long time because, for the most part, it works well. Moreover, due to the severity of alcohol problems throughout our country, numerous federal agencies work to assist states in addressing alcohol-related prevention, treatment, law enforcement, and research. Therefore, the CARE Act would go a long way to help ensure that such federal programs are not undermined by current legal threats to state-based regulation. I want to share 3 specific examples of state regulation to protect the public's interest through prevention. The first is access to alcohol. The research is abundantly clear that the more access people have, especially youth, to alcohol, the greater the number of problems communities will experience. By controlling where and when alcohol is sold, states can seek to prevent those problems associated with increased availability. And states are in the best position to evaluate and address problems facing their communities and restrict access when and where it is needed. Another area where states need to be able to regulate is pricing. For example, policies that prohibit volume discounts make good sense from a public health perspective. Substantial research shows that higher alcohol prices are associated with reduced alcohol consumption, especially in youth. Marin Institute is very concerned about legal challenges of pricing policies by certain chain stores in the retail sector. Cheap prices for consumers should not be the only consideration. In fact, such concerns should be secondary to public health and safety. A third important aspect of state regulation is the 3-tier system. Requiring that alcohol be sold from producers to distributors and then to retailers has proven to be a necessary policy for protecting the health and safety of the public. The 3-tier system helps to ensure that the state has adequate oversight of alcohol sales, helping to prevent aggressive marketing and sales tactics. Although how to best regulate alcohol might seem like any other rhetorical debate over balancing the interests of private industry with government, there is an important difference. Diminished state authority will most certainly result in more lives lost, higher costs, and more families forever changed by alcohol consumption. Odds are that most people in this room know someone who has been negatively impacted by alcohol use. Make no mistake, this is not a rhetorical debate. This is about saving lives. For decades, alcohol has been recognized as being different because it is. The cornerstone of that recognition is the state's authority under the 21st Amendment to regulate the sale of alcohol to ensure an orderly marketplace. I urge the committee to strengthen the regulatory authority of states to ensure that the public health and safety of the American people remain the top priority, and to continue to seek additional ways to support state-level efforts to reduce alcohol harm. Thank you very much.
Thank you, Ms. Simon. Ms. Simon, I'm out of time, but you look a little skeptical.
Sorry, hard to hide that. So we are opposed to internet shipping. And the reason for that is concerns over, youth don't need any more ways to get access to alcohol. And this idea of requiring, IDs, there are a lot of problems with third-party ID checks. We can't expect FedEx to be checking IDs when these, bottles get delivered to who knows where. So, it's disingenuous to me to separate, saying that we really support states to control youth access, but we don't want, this word discrimination, I think, is being tossed around a little too freely when these aren't mutually exclusive. This idea of giving states the ability to control access and yet, opening up state borders to be able to ship wine all over the country. And, wine isn't a benign product either. I think the wine industry likes to kind of think of wine as not benign, and it's 14% alcohol in most cases. So, and also we're very concerned about opening the floodgates. So if you let wine be shipped all over the country, what's next? And so to me, it's really about restricting as much as, reasonably feasible access to alcohol.
Thank you, Ms. Jensen. I think you made your point very well, and I do want to thank the chair and the ranking member for their indulgence.